Hello, this is Dr. Steve Kraft. I'm your Zeeland chiropractor. Every day we get these health alerts that come into the office, and we distribute them out to our patients and out to the community. One of the subjects that came on here was interesting to me, and it talked a lot about heart disease. And it's an epidemic in our country. Many people are plagued with it, some that don't even know that they have heart disease. We're going to go over the causes of heart disease and the solutions. Very simple. It's not rocket science, but it is something that if we have a knowledge of it, we can move around it instead of having that affect our life. So the first thing we look at is in heart disease, either we have an increased blood pressure. Normal, they say, is about 120/80. We want to be within that range. We want to be close to that. We don't want to be way above that, or in many cases below that. And then heart rate variability, which is your heart's ability to adapt to different situations that your body goes through. Our body is always changing and acclimating. For example, you go outside and it's cold outside. What happens? You get goosebumps. You start to shiver. Body's trying to warm up. You go outside, it's really hot. What does your body do? It sweats, and it's trying to relieve heat from the body. Your body's doing that in thousands of different ways every single nanosecond. It's that intelligent. The heart is no different. The heart is constantly acclimating itself to every situation that your body goes through. That's why we want to have a good heart rate variability. So when we look here, number one on the list is obesity. And obesity covers being either diabetic or pre-diabetic, people who are addicted to carbohydrates, and they eat too much, and they are not physically active. That pretty much covers it. And along with being diabetic, with being pre-diabetic, is a acidic system. An acidic system creates a lot of lactic acid within the body. That inhibits calcium from coming into the tissues, which also contributes to heart disease. Smoking inhibits your cardiovascular system, inhibiting its ability to do what it needs to do, causes it to degenerate, to dry up, and not to function nearly as well as it should. People who smoke have a very high rate of heart disease and also heart attacks, for that matter. And then we have parasympathetic tone. Parasympathetic tone in your nervous system, you have the sympathetic and the parasympathetic nervous system, but we want to have a good tone of both. We don't want to have one overriding the other. So with regard to heart disease, we want to have a good tone of parasympathetic activity and a good tone of sympathetic activity. So what are the solutions here? One is a balanced diet, more whole foods, healthy fats, healthy meats and proteins, less carbohydrates that are processed, simple sugars, more things that are natural, more things that are from the ground, less things that are processed. Physical activity, 15 minutes a day of getting your heart rate up, get on the floor, do some push-ups. You can even keep your knees on the ground. Do some sit-ups. Run around the house, run up and down the stairs, do whatever you have to get your cardiovascular system pumping blood through the body. What that does is it keeps the arterial system healthy. And when that happens, we got a healthy cardiovascular system, less stress on the heart as well. So your body needs physical activity. If everybody would just adopt a healthy nutrition, healthy diet, get off the carbs and start getting physically active, most heart disease would be eradicated. And then we come into the parasympathetic tone. How many people are stressed? Mentally stressed, either due to just any situation in life. Everybody, for that matter. Well, how your body handles stress is everything. So learning how to relax, learning how not to worry, whatever techniques you find to be able to balance your life, to not allow that stress to overcome your system. Because when your body does get stressed, That parasympathetic tone that we talked about that has to be there in order for our heart to be healthy, it's all out of whack. It's not in balance. So we got to bring things into perspective. Less worry, more relaxation. Keep yourself focused and learn how to keep yourself calm. Another perspective from what we do in chiropractic when we adjust the spine, from the occiput and the cranium all the way down to your sacrum and your pelvis. You have two divisions of your nervous system, which is the sympathetic and the parasympathetic. Now, anytime someone is adjusted properly by a good chiropractor, this system is balanced and it brings tone, and we have studies that prove it. In fact, we have one right here where they had 22 patients with acute low back pain. Some got a sham adjustment, some got a good adjustment, and they found that the ones that got the good adjustment had better tone in their parasympathetic nervous system. So getting adjusted just for the sake of creating a tone within your nervous system will help lower blood pressure and also affect heart disease and heart function. That's pretty much it. I'm Dr. Steve Kraft. Doctor means teacher. I'm here to teach you to be healthy. I am your Zeeland, Michigan chiropractor. You have a terrific day.